Hi and welcome to Chirosports. I'm Dr. Alfie Arcidiacono. Today we're going to talk about a very important topic, low back pain. It's interesting that a lot of people accept low back pain as a normal part of life, but in actual fact it's interesting that low back pain is the second most common condition after a common cold. That's how common it is. And there are even books that are written just on managing low back pain. And what's interesting that most back pain again starts off in a very trivial way. It can be lifting a child out of a cot. It can be a football accident that creates a little bit of low back pain. And the good news is that in most cases when you have low back pain, the actual pain can settle down maybe in 4 to 5 weeks on its own. And you wouldn't be the only person in the world who decided that you didn't need to do anything because the back pain went. The danger that you have is that even though the back pain's gone, the dysfunction in your spine continues. And so over the course of many months and years, in actual fact what happens is the vertebrae stop functioning properly. And as a result of that abnormal movement in your spine, a bit like a poor wheel alignment on a car, the tyres will start to wear down. And in between the vertebrae we have a disc. And with that disc, that distributes the load through your spine. And what will happen is that the disc will start to wear. And it may cause intermittent back pain that then starts to settle down. But one of the most common problems that can affect your lower back is it can start to impinge the nervous system. And believe it or not, the weight of a 20-cent coin in the back of your hand is enough to stop a nerve functioning up to 60%. So if you have a little bit of pressure for a short period of time, your body can sort of maybe cope with that. But if you leave that pressure on for a long period of time, and that's affecting that large nerve that runs down the back of your leg called the sciatic nerve, that can cause long-term problems. Now, one of the key things to look at is not just the back pain, but also the leg pain. If you have leg pain, that's a really important cue to make sure that you have some attention. And you certainly follow that with a chiropractor. The thing that you need to also be aware of are things like pins and needles, or as it progresses, numbness, which is even worse. But the other thing that can also happen is weakness. If you start to have weakness in your legs, you can't stand on your toes, that is a very important sign. So if you experience any of those signs or any of those symptoms, it's very important to speak to a chiropractor at Chirosports to see if there's some way that they can help you. There's some very simple strategies that we can do that can really help you out. Certainly taking drugs will mask the symptoms. They might give you some short-term relief, but certainly not addressing the cause. So what we need to do is to address the cause, correct it, maybe give you some exercise that's going to facilitate the healing process so you can live a long, strong and healthy life. Thank you.